Hey guys, welcome back to my channel, and today we are coming back with a podcast, and our guest for today is Dr. Salil Sharma. He's a master in surgery for your eyes, nose and throat, and also he is very experienced, but the most important thing for us is he's also a fitness enthusiast and he's been exercising, working out, and also has an amazing physique, and he's been doing this for the last 30 years, and he has been practicing medicine since 1996. So that's amazing, but at the same time he's a fitness enthusiast, so he's not like just a doctor, he's a jacked doctor. So I hope you enjoy the podcast, share it with your friends, and let us know what you want to see next. We'll be doing more of these podcasts with doctors, athletes and all that. So thank you so much for the support. Enjoy the podcast. All right, so today we have Dr. Salil Sharma. Before I give a larger introduction, I would like to tell you that he is also related to our channel in a big way because one of our oldest subscribers, Siddharth Sharma, he's his dad. So we requested him to come on the channel to start off our podcast again. And I would like to welcome you, sir. Thank you so much for being on our
Thank you.
channel. So I just want you to give us a small introduction. I already have introduced you, but just give a brief introduction about yourself.
Thank you, Shreyas, for having me over, and my greetings to all your subscribers. I am Dr. Salil Sharma. I am basically from Delhi. I graduated and post-graduated from Delhi University Maulana Azad Medical College. I have been a fitness enthusiast since as far as I can remember. I probably started lifting weights when I was in class ninth, and since that day till today, I have been lifting weights. And I'm quite inspired by what Siddharth tells me about you and your channel. And
Thank
it's
you.
good to be with you.
Thank you. Thank you so much. Thank you so much. So I don't want to go off topic here because I believe one of the main reasons why I've got Dr. Salil here is that I am a fitness coach, okay, and my expertise is limited when it comes to medicine. I don't know much about medicine. I don't know much about treating diseases. I can help you if you are a decently healthy person. I can make get you even more healthier, but when it comes to treating certain kind of illnesses, which in India hypothyroidism is a big problem, and since Dr. Salil is an ENT, is also a surgeon, so I would like to ask him, like just to give us basics about the thyroid in general. What does the thyroid do and why it is so important for the rest of our body and the functioning of our body.
Well, thyroid gland is a small H-shaped gland which is situated at the base of your neck anteriorly, just below your Adam's apple. Now, this is one of the very important endocrine glands in the body in that it controls the metabolism of the body. Now, metabolism, as most of the fitness freaks would be knowing, is how your body converts, in a layman terms, food into energy. Now, the thyroid gland controls all these functions. It controls your breathing, it controls your heart rate, it controls your blood pressure, it controls your sweating, it controls your temperature, hemostat, and it controls your even mental well being, sleep, and mental well being. So, it's one of the very important glands in the body.
Right. So, coming to that, I also want to know, if you can tell us a little bit, not too much in detail, but a little bit about how the metabolism works when we eat food, right? Let's say I eat a cup of rice, I eat a chicken, okay? If you can little bit kind of explain a little bit about how it so-called, uses it for energy, if you can tell us that process as well, that would be really helpful.
See, there's a very famous equation by Einstein: E is equal to mc square.
Hmm.
Energy is equal to mass.
Hmm.
It's directly related, proportionate to the mass. So
Right.
any mass can be converted into energy, and this is done most beautifully in a human body,
Right.
where anything you eat goes to our gut. It is digested into its constituent materials, which are then absorbed, and they are taken to the liver, where they are further broken down, and then subsequently they are formed into something which is known as ATP, adenosine triphosphate. Uh, Adenosine triphosphate is the molecule which the muscles use for energy.
Right.
And of course, the food is not just metabolized into ATP. There are a lot of other things which it's meant to metabolize into. But for health freaks, I would just say it suffices to say that food is converted into ATP. ATP is used for muscles for contracting, and that's how you exercise.
Right, right. So when we use this supplement creatine, right? That is how it helps, with the final couple of reps when you are out of ATP, you kind of, get that instant, boost of last two reps. And that is what creatine does. Am I right?
That's right, because
Yeah.
creatine helps in phosphorylation of rephosphorylation of adenosine diphosphate into adenosine triphosphate, which is a substrate for producing the muscle contraction. So
Right.
when you're using creatine as a supplement,
Right.
it will help the ATP reserves of the body to be restored so that you can exert a little bit more than what you would have otherwise.
Right, right. Okay. So thanks for giving us the basic information. We'll get to supplements as well. I would like to get your inputs on a couple of supplements. We'll do that later. But now I just want to know why there are so many cases of hypothyroidism in India. We also have hyperthyroidism, right? But that is not. I don't think that's as common as hypothyroidism. If you can
Yeah.
explain us the difference between the two and why one is more prevalent than the other.
See, hypo means that the thyroid is not functioning adequately. Hyper means it is functioning more than what is desired. So, thyroid hormone secretion is a very intricate, chemical reaction, or it is controlled by a gland known as hypothalamus in our brain, which further directs pituitary gland in our brain, which then releases a hormone known as thyroid stimulating hormone, which makes the thyroid gland release its T4 and T3 hormones, so to say. T4 is the basic hormone of thyroid and T3 is its active form.
Hmm.
Now, hypothyroid means that T4, T3 secretions are not adequate.
Hmm.
Now, hypothyroidism has become very common these days because of numerous factors. Primarily, of course, because more diagnostic techniques are now available, health facilities are more accessible to people. So, more and more cases are being diagnosed. But having said that, it's just not because of increase in awareness and diagnosis. There are a lot of chemicals present in our environment which are contributing to hypothyroidism. Primarily your biphosphonates, primarily your phthalates, which are very common in all the plastics which you use. Drinking water from plastic bottles, plastic cups, plastic containers which keep your food. So of these phthalates are very, very goitrogenic, so to
Hmm.
say, because they interfere with the absorption of the molecule of the thyroid, its
Hmm.
conversion into its active form. And these microplastics, they have now been found to be very deeply embedded in many of our endocrine glands, not just thyroid gland, but many of our endocrine glands, and they are causing a disruption in their functioning. Then
Right.
there are other factors like perchlorates, which the use of which has now been discontinued to a great extent all over the world. Then deficiency of iodine, which again now, although it is still prevalent in our part of the world, but in healthy communities, because of supplementation of iodine in the eating salt by the government, that has gone a long way in decreasing the incidence of hypothyroidism. But still, the environmental factors are dominating. Then there are autoimmune diseases where our immunity works against our own body. There is something which is known as Hashimoto thyroiditis, where the immune cells of our body, they destroy our thyroid gland eventually, and they cause hypothyroidism. Hyperthyroidism is also common, but hypothyroidism incidence has increased quite a bit in the last about 25 years or so.
Right. So now that you explained the theory and how it happens and all that, I also want to have a doubt. Like some of them, they do not have any problem with hypothyroidism. They are just just normal people. Within a couple of years, they tend to gain a lot of weight. They put on a lot of weight. They lead a very unhealthy lifestyle. I know that leading unhealthy lifestyle, it affects your your blood sugar levels. It affects your liver, fatty liver, and all that. But how much of a relation there is between putting on a lot of weight, because I did put on a lot of weight a few years back, and obviously the body doesn't function as well as it did when it was leaner with less body fat. So how much of a relation or how much hit does the thyroid take when you put on weight drastically over a smaller period of time? Like, I'm not talking about weight in 2 3 years, talking about instantly, like 3 4 months. People tend to put on 5 to 6 kgs or 10 kgs. How much does that affect your functioning of the thyroid?
See, in fact, it's the other way around. If the thyroid is not functioning adequately, then your metabolism will go down.
Okay.
Once your metabolism goes down, your fat metabolism will be affected quite a bit, and one tends to gain weight. In fact, one of the few signs of a hypothyroid patient which we see are xanthomas, which are small deposition of fat plaques, which can be visible even around your face and around your eyes. Patches of fat plaques around your, one of the few signs which you can just spot on a person's face and see and know that he or she is hypothyroid.
Hmm.
Then there is fat deposition all over your body, even fat deposition, fatty kind of a myxomatous tissue, which we call deposition in your vocal cords. And the
Okay.
person has a hoarse voice. So it's said that it's one of the diagnoses you can make on the phone. The person
Okay.
is sounding hoarse, and you know that the person might be hypothyroid. So it's
Okay.
one of the giveaway signs of hypothyroidism. So
Okay.
hypothyroidism itself causes decrease in metabolism, which causes gain in weight, gain in especially the fatty weight, and decrease in the muscle mass, because the catabolic and the anabolic states both are disturbed. Now, when the person will gain fat, then the insulin resistance will prop up. Then the person will, it's a vicious cycle. When the insulin resistance props up, the person goes into more, on a gaining spree of fat. So that's how it happens. So you have to correct the thyroid gland so as to bring back the person's metabolism to a normal state so that he or she can lose weight.
Right, right. So I totally understand what you're saying. But do I have that voice though? I'm just asking
No,
you.
no,
Okay.
no.
So yeah, so that is really good information about that. But I also want to know, like, if let's say my thyroid is fine, okay, my thyroid is fine, and I gain weight, I put on weight, okay, due to my lifestyle, like I ate lot of junk food or alcohol consumption and things like that, then would it hamper your thyroid? A healthy thyroid, or a thyroid that is functioning normally, you put on weight because of your terrible lifestyle, does that then affect your thyroid? Because obviously when you put on weight
Not Not directly, but
okay,
having an unhealthy lifestyle puts a lot of oxidative stress all over your body.
right,
The
right,
oxidative radicals which are released, they tend to affect all the glands, especially the endocrine glands. And
right,
also, of course, thyroid gland tends to get affected.
right,
One of the few environmental reasons for why we are seeing so many cases of hypothyroidism is because the pollutants which are released in the environment, they call oxidative stress in our body, and they tend to damage the organ. So
right,
it might, in your case, it might have been that your lifestyle might have contributed to increase in oxidative radicals, which
right,
eventually affected your thyroid gland. And you
right,
must
right,
be having a genetic predisposition.
right,
Not
right,
everybody who is exposed to this will be affected, but
right.
people who are genetically predisposed, they will be affected.
Right. No, I mean, I never had issues with my thyroid functioning. The TSH, T3, T4 always have been normal. But in some of my clients, yesterday I just posted a picture of my clients. TSH was like terrible, like 13 or 14 or something like that. And within 2 months of proper good lifestyle, he is on medication. He is on medication, but his TSH levels have come down once he started following a healthy lifestyle and eating
Yeah.
the right kind of food as well. So coming to the next point now, I don't know how much of social media you follow these days, but as a doctor, again, you treat real patients. You don't come online and talk a lot about do this, do that. But I see a lot of people wearing I mean their apron or their the white coat and coming online and telling people carbohydrates are bad. I know this is not related to our thyroid and all that, but I just want to get a basic information about the whole blood sugar spike. Since we touched on insulin resistance earlier, I just want to know how much carbs are bad. Like I'm asking you this because a lot of people are falling for this fear mongering where they are told do not eat carbs at all, or eating white rice is bad, or eating any kind of simple carbs are bad for you. So I just want to know your opinion, not only based on your personal opinion but also treating patients over a prolonged period of time. What do you think? Is it, are carbs actually that bad when it comes to our overall health or weight gain or weight loss or anything like that?
If carbs were bad, God wouldn't have made them.
Yeah,
Too much of anything is bad.
right,
So the right way to live life is live life in a moderation. If you are eating white sugar all day, if you are snacking on sugary treats and cakes and butter and cookies and colas, and it's like having a vault of money. You see, if you put in 10,000 rupees and you withdraw, 9,000 rupees, you'll be left with 1,000 rupees inside. But if you put 10,000 rupees inside and don't withdraw, there'll be 10,000 rupees in your wallet. So it's
Right.
like that. If you put in that amount of calories in your body, but then you are exercising, you are doing 100 kilometers of cycling in a day, then it's fine. But if you're lying on a couch and watching Netflix the whole day and you're chomping on cookies and pizzas and burgers, then definitely you'll gain weight. And
Right.
this mongering that carbohydrates are across the board, they are bad, it's wrong.
Right.
Carbohydrates are needed to produce energy immediately. And if the person is just relying on a fad kind of a diet, which is just based on pure proteins and pure proteins oblique little bit of fat, then he or she is into a state which we call ketogenesis.
Right.
And that's it's in the long term, it damages the kidneys very badly, kidneys and the liver. So
Right.
all these fat diets I would like to convey to all the people, please do not follow them. Follow our traditional way of how Indian lifestyle used to be. Take millets, eat in moderation, exercise daily, and keep yourself active, sleep on time. uh, you know like they used to say, early to bed, early to rise makes a man healthy, wealthy, and wise. All these dictums which have come down to us down the ages, they actually hold true.
Right.
So please do not go into fads, and be take moderation in everything, and be
Right.
healthy.
Right. And activity is another thing that, people underestimate, I think, because I feel a lot of people, in India especially, I see is that they are scared of carbs, and they might get insulin resistance because of carbs, because they are not active. Most people, I was reading research recently, not research, just like a correlation study or whatever, they found that around 57% of Indians do not exercise, do not perform exercise of any kind. You know, and it is even more in women, like they do not exercise as much as compared to men. And I believe the whole diabetes and all that, people used to eat a lot of carbs. My grandma, my mom, my parents, they eat a lot of carbs. Obviously one of them is diabetic, but I feel that, if they were more active, things would have been totally different. It's not
Definitely.
the and also the caloric intake. If you eat 80% of your calories from carbohydrates, obviously that's not good, right? Because protein and fats are very important to, balance the glycemic load and
Correct.
all that. So I believe that I'm tired of saying, because sometimes people always come on my videos and say, tu doctor hai kya, tum doctor. So I always believe that, it is important that someone like you who is experienced, I think you have what, 30 years almost of experience in this field of medicine, and you have seen thousands of patients, and you have treated most of them. So that's why I, always wanted to know from a doctor, because there are a lot of doctors who also say that carbs are bad. There are a lot of doctors who I have met, they have told me that, you need to go on a keto diet. Because I was on the heavier side, they told me, you need to go on a keto diet as well, and I definitely did not agree with it. And obviously someone like you cleared that out for us. Now coming back to the thyroid, hypothyroidism, uh, what do you suggest? What do you suggest? Obviously it depends from person to person, but what do you suggest for someone who has been diagnosed with hypothyroidism, who is on medication? Is it something that he can maybe get off of someday, or is it like done and dusted? There's no coming back from that.
Mostly thyroid disorders are irreversible. Mostly, I say. There are few which are reversible, like sometimes ladies tend to develop hypothyroidism during pregnancy, and once they have delivered, the thyroid comes back to normal. Another condition which I mentioned earlier is Hashimoto thyroiditis. Sometimes, if it is treated very early in its course, it has to be treated with steroids. Sometimes the inflammation decreases so much that the gland starts to function normally.
Hmm.
Then, in cases of iodine deficiency induced hypothyroidism, once you supplement the iodine in it, it will come back to normal. But majority of the cases are irreversible, and the person will have to take the thyroid medication for whole life.
Hmm. And Hashimoto's, you're talking about that. Isn't that one where the TSH levels goes extremely high?
Yes, it initially it will go very low when
Okay.
the antibodies against the thyroid are mimicking the action of the thyroid hormone. Then the TSH level will fall down very low. So
Okay.
once the antibodies start destroying the thyroid gland, the T3, T4 levels natural they come down. Then the TSH rises.
Right.
So
Right.
it's a high followed by a dip. So
Okay.
it's a very,
Okay.
very typical picture, and there are certain blood tests which are specific to it, which we conduct and know that
Okay.
the person is suffering from Hashimoto's.
Okay.
It's
And
one
are
of the
there?
rare disorders, not very
Okay.
common.
Okay. Okay. Now you also told us about some physical symptoms, like, the hoarse voice and fat depositions and all that. But
Xanthomas.
yeah, but are there any like other symptoms like, that you might feel, or some people might never feel? Is it like something that you can detect? Like obviously the hoarse voice and all. I mean, we don't think about it as on in our daily life, right? But are there any other symptoms that people can look for from someone who does never felt anything, but suddenly he might
From a
start feeling?
layman's point of view, one can see lethargy, um, intolerance to cold, weight gain, um, confusion.
Okay.
Especially if it happens in children, they can be a delayed in mentation. The development of the brain might be affected. Uh, as I said, weight gain is a very, very common feature, and intolerance to cold.
Hmm.
That's a very common feature which many people notice, that they have suddenly developed these things which they were never having in their life, and they get their thyroids tested and they find that they are hypothyroid.
Hmm. Right.
So
So
one has
the
to keep these things in mind, common
Okay,
features.
okay, okay. And one more thing is bodybuilders. Like bodybuild. I mean, I don't think a lot of bodybuilders watch my channel, but for just general knowledge for the public, bodybuilders do use T3 during their fat loss journey. Maybe you can give us a minute about why they do that, and what are the harsh side effects they might get from that as well.
See, T3 is taken as a supplement by bodybuilders to increase their metabolism so that they are able to lose fat more easily. Now it's a two-edged sword. When you put in a T3 which is much above the level which your body needs, what effectively happens is that your thyroid gland starts to stop producing T3. Then that signal goes to the pituitary, which stops secreting TSH. And then from there, it goes to the hypothalamus, which stops secreting TRH. So if the T3 hormone has been used for a very long period of time, not only will you end up having a very decreased level of natural T3 and T4, your pituitary and your hypothalamus gland will also be affected. They
Right.
may not be able to recover after once you discontinue. If you have discontinued synthetic T3 at a very early stage, they might come back to normal. But if you have taken it for a long period of time, once you stop taking that T3, your own thyroid gland won't be able to produce the hormone. Then
Hmm.
you will be stuck with taking medication for your whole life.
Right. And if they stop, they might end up putting on weight. Right.
Then they'll stop. Definitely, they will put on weight. It's see,
Right.
the endocrine system of the body is like a symphony where every instrument has to play in harmony. If one instrument goes out of sync, the entire symphony, the entire opera will go.
Right.
So you can't tinker with these things.
Right. Right.
People are taking hormones like pop in tablets. They eventually all of them pay, all of them
Right. Right.
across the board. Or you see the lifestyles of the bodybuilders who have now retired. See how many medical complications they are facing.
Right.
Nobody
Right. Right.
talks about them.
Right. Right. Right.
Mm.
Yeah. And I mean, I mean, this is something private, but do you often see, do bodybuilders come to you for
Yeah, they do. Especially when I go to the gym and then they realize I'm a doctor. They will catch me in the changing room and they'll be asking me, what should I take? Should I take this? Should I do that? Should I? So my advice to all of them is, if you are asking me, I will scare you so much you won't be able to take anything. Please don't talk to me. But if
uh,
still you want to know, I will tell you all the side effects and how hell your life will be once you stop taking these things. So
right.
please do not talk to me or do not take these things.
That's good. That's good. It's the same with testosterone as well, right? Like where you
Yes.
inject testosterone, your testicles, they stop producing testosterone, and then if you do it for long enough, then you don't have any other option but to take it for the rest of your life, right?
Yes, yes, yes,
Yeah.
yes.
So
Yeah.
yeah. So that is something for youngsters who might be like Sir said, he gets approached by people in the gym, but someone might approach you saying, do you want to compete and do you want to lose fat? And I've seen a female client of mine, I think from Delhi itself, long back, that she was given this along with some anavar or something like that, and there were so many complications that she could not come back from, and it's very sad, like, and it's unfortunate, but and it's easily available. That's what I've been told.
It's
Like,
easily available.
it's easily
Yes, yes,
available in India, that they can just go
yes,
and buy these things
yes.
from the pharmacy. So now, since we are a fitness channel, a lot of people who might come across this video might want some tips about losing fat, on with hypothyroidism. Now there are medications, obviously, and medications. How much do medications actually help? Now let's say someone has put on 30 kgs, okay, and they are trying to lose that 30 kgs, and obviously they are diagnosed with hypothyroidism. Now their doctor has prescribed medication, whatever the dosage. Let's take the lowest end of the dosage, and they are looking to lose fat. Okay, what would be your training and nutritional, recommendations that you would give? I think training, I think there's not much they need to worry about. As long as they do it, it'll be fine. But in terms of nutrition, what would you suggest?
It's a patient of hypothyroidism trying to lose weight, being on medication so that his or her FT3, FT4, and TSH levels are normal would be same as a normal person with a
Okay,
functioning thyroid. So if you
right,
are taking medicines which are maintaining your TSH level, your FT3 and FT4 levels, then the entire things which apply for a normal person will apply for you.
right,
It's like the example I gave of the vault where you put in 10,000 rupees and you take out 9,000 rupees. If you
right,
don't take out 9,000, that fat will stay inside.
right.
So you have to eat healthy, you have to exercise regularly. That's about it. There is no third way.
Right. So there is nothing like where people make videos saying, your metabolism is extra slow, your metabolism extra slow. But like you said, if you're on medication, it'll do the same job that your body would otherwise do by itself, right?
Yes,
So
yes.
this idea of the whole calories in, calories out still applies to
Of course.
yeah, to
It's,
people who are
it's as simple as that. It's not that if you're a hypothyroid patient and let's say your required dose is 50 micrograms per day, and somebody advises you, no, you go on and take 100 micrograms per day, then you are just fooling around with your system and you will be worse off. So,
right,
my advice to everybody would be please follow your doctor's advice, whosoever is treating you,
right.
and follow it to the T. Please do not supplement or substitute medications on your own, and please do not go by the word of all those pundits which are present by a diamond dozen on the
Influencers.
neck, influencers. So please do not go by that. It's your body, it's a very sacred thing. Please do not abuse it, and do not
Right.
let anybody abuse it for you.
Right, right. That's very important to understand. Another thing, this is for my personal understanding, because I'm trying to help out someone. So they had cancer long time back. I think about 10 years back. I think the thyroid is removed. Okay, they don't have the thyroid at all. So they are on extremely high levels of medication. I think 225 mcg. Do anyone take people take
Yeah,
that,
yeah,
right?
sometimes.
So he's
Yes,
on
yes.
that, and he is extremely heavy, for 220, 140 kgs or something like that. So now that you told me that, if they're taking medication, it should function similarly, right? So does
Yes.
that apply for this person as well, who
See, metabolism in the body is not just dependent upon thyroid gland. Thyroid gland is a very important part of it, but the profile which you have told me of the person, he or she has undergone a severe stress in the body, where she or he must have undergone a
he
big surgery. He, and after that he must have undergone radiation or radionuclide,
right,
ablation of the any metastasis if he had. So they do tend to damage the other sections of the body which also are, important part of the metabolism in the body. Secondly, the person must have been under a lot of mental duress which releases uh, uh, the hormones from the adrenal glands which contribute to the fat retention in the body. Then the person's exercise must have come down drastically during that period.
right.
And the muscle mass must have gone down. So there are a lot of factors which must have influenced that person. But keeping the thyroid levels maintained by taking proper medication and exercising and eating correctly, I'm sure he will improve. You
100%,
are an expert
100%.
coach. You will.
Yes,
I'm
yes.
sure you will help
Yeah.
him.
And this is exactly what I told him, because consistency is something that he, struggles with.
Consistency is the key.
Yeah,
Consistency
yeah.
is the key. You cannot expect results overnight. You have not gained weight overnight. You will not lose it overnight. As
Right.
simple as that.
Right. Now again, I never go into scaring people, or like telling people this is dangerous, that is dangerous. But I would also like to know if there are any complications from taking, medication, like get taking medications of hypothyroid, because I've read somewhere it might affect the cardiac system. That's what I've heard. Again, I might tell me if I'm wrong, but I just want to know
Yes.
something about that and what precautions they can take.
See, again, I will say never medicate yourself. Never buy over the counter medicines and listening to the WhatsApp University and the Google Devta and all the influencers. Please do not do it. Stick to your doctor, whether he or she is an endocrinologist or a ENT, and follow their advice to the T, because these hormones are very, very, very potent things. And thyroid hormone does tend to affect your heart if you are taking more than the required dose, so that your FT3, FT4 levels are higher. You will definitely experience increase in heart rate initially, and if you will continue with it, you will face other cardiac complications sooner than later. So please
Mhm.
do not do it. Please do not
Right.
do it.
Right. So yeah, that's also very important. Now, again, there are certain food items that people are told to avoid when like cabbage and things like that. What do you suggest? Is it
They
like
are
that
basically,
serious?
yeah, it's yes, to an extent. Cabbage and broccoli and kale. These vegetables, they tend to carry certain chemicals which are known as goitrogens.
Hmm.
They tend to affect the thyroid hormones. Definitely, they act at various stages. The secretion of the thyroid hormone, then its conversion from T4 to T3. But not everybody is affected equally. People who are susceptible,
Right.
they will be affected more. A person who is not susceptible may not experience these things. Then there are certain uh, diet items like soya, like tofu. They will tend to cause problems in absorption of the thyroid hormone, of your thyroid medication, if you are taking it with them, in close proximity to each other. Then if you are taking any iron supplement, you are taking any calcium supplement, or you are taking any anti-acid medicine along with your thyroid medication, then they will affect. So better to space them for 3 to 4 hours.
Okay. Okay.
But having said that, most of the things are overhyped also.
Okay, good, good. So now, I think now you have answered most of the difficult questions, but I think I'll ask you the probably the most easiest question, which is regarding your own fitness journey. Siddharth has told me a lot of things, and I do agree with you on absolutely everything. I've also told him to train like how you train. So I just want to know how you train. I know a few doctors who do work out in the gym that I go to as well, but what he has told me about you, it was very interesting to me. So you come from the whole old school methodologies of training, it seems. So I just want to know,
Yeah.
I hope I can get a picture of you from your heyday or whatever. But if you don't, it's okay. But I just want you to tell us, for the next few minutes, what your recommendations would be for someone who is maybe 30 years old right now. I've been lifting for 12 years, but I would like to know what would your suggestion be for the younger generation, because they get tempted by a lot of videos on the internet, all these fancy exercises, and a lot of different things, like 6 times a week, 7 times a week training and all that. I just want to know your uh, philosophy of weight training, especially.
See, there was a there was a Mr. Olympia called Franco Colombo.
Hmm.
He became Mr. Olympia probably 3 times. He was in the company of Arnold and Lou Ferrigno, one of the our era bodybuilders. He used to say, "You just give me one barbell and you give me as much weight as I need, and I can make you a kind of physique, which any kind of physique which you want." For people who would not be knowing him, he was the trainer for Sylvester Stallone when he beefed up for Rocky 2 and Rambo. So we used to follow the same old school method of training, um, train till you drop dead. But and of course we were not eating the way we should have been. We were basically a middle class family, and eating, you know, probably the only protein intake would be 4 or 5 egg whites per day, which again used to be a very big deal at that point of time, or maybe chicken once a week. There were no supplements. There was nothing known as supplements at that time. Parents used to insist that I should have a lot of milk, but I was having lactose intolerance, so I couldn't do that too. So it used to be very, very heavy training, and literally. killing yourself. But I suffered quite a bit because of that, and I have probably injured all the joints in my body. And because of those injuries, now I can't lift very heavy as I used to. So my advice to all the youngsters would be, don't go for any fancy stuff. Retain very good form when you are exercising. Try to push your boundaries. Eat clean. Keep a good record of how you are exercising, what you are eating. Keep measuring your weight. Keep measuring your dimensions. Now there are apps available for that, and certain gyms I have seen, they have even BMI machines where you can know the amount of fat you are carrying and the amount of muscles you are carrying, so that you know the trend where you are heading for. And please do not be influenced by all the pictures of Mr. Olympia or Mr. Universes which are shown on your gym's walls, and all the the girls. Please do not get influenced by them. They are very artificial. Those people have done things which one should not be doing. So keep a realistic picture. If you will lead a healthy lifestyle, eat right, exercise, maintain a good form, you'll be very very well off, very good.
Right. And one more question I have, which is about protein. Now, you said you did not get a lot of protein to eat back in the day, and obviously you probably overtrained as well to,
Yes. Yes.
make up for the lack
Yeah.
of diet.
No, it was more out of the kick it used to give, the endorphins which used to be secreted, that used to make us, work harder. Once
Right.
I fell down from the stairs, climbing down from my gym. My gym used to be on the second floor, and we had done a heavy thigh workout. And I was coming down, and the last three or four steps, my legs just gave away, and I fell down. And I kept on sitting on the floor for a good 20 minutes before I could, start my motorbike and come home. So
Right.
please do not do that.
Yeah. No, so how much protein, like for obviously we know that 0.8 to 1 gram of protein per kg of body weight is the recommended one for
Yeah.
normal people, who probably don't
No.
exercise. But for people who exercise, according to your, I'm sure, I'm 100% sure, knowing Sid, I'm sure he got most of the habits and everything from you. So I'm sure you're also always reading about studies and this and that. So according to you, from what you have learned, what would be the what would a basic guideline for people who are exercising, let's say 5 times a week, like with good intensity in the gym? What would be your protein recommendations be, maybe per kg?
Per kg would be around. See, if you are into a building kind of exercise, you want to build, you want to beef up, then you should take at least 2.5 grams per kg body weight. If you are into just uh, maintaining with a good intensity of exercise, maybe anywhere between 1.5 to 2 grams is fine. If you
Right.
are not exercising, or you're doing very mild exercise, then 1 gram per kg body weight is good enough. But please let me tell you this, that Indian diet is very, very poor in protein, very poor in protein. So kindly read up on the kind of foods which you are eating, see how much carb, protein, and fats they're having. You will know for yourself, and you will have a guideline where to improve your diet.
Right.
I'm
Right.
not
So
recommending non-veg diet. I'm not saying you turn into a carnivore diet overnight. It's not needed. So even vegetarian diets can supplement with intelligence. You can, fulfill your protein requirement. But please do check out the things which you are eating and see the contents of their diet.
right. So I think for vegetarians, mixing a lot of different food sources is the key.
Is
Just
needed.
eating
Yes.
one protein source is not going to do it for
No.
them. Yeah.
No,
So
because many diets contain one particular type of amino acid in abundance, other contain other. So you will have to combine. And the only way to know about is either you get a good dietitian to help you, a good health coach, or you read up.
right. That's the third thing that you said is really important. A lot of people, they don't want to put in that 10% extra effort to learn more. The one
It's not too
last,
much. It's not too much.
yeah,
There are
with the
so
basics.
many websites available.
Yes, yes.
And you have to. You don't. It's not a rocket science. You can just read about it, and you can compile your diet chart in about 1 hour's time.
Right.
Not
One
even
last
that.
question, sir, which is regarding supplements. A lot of people they go to doctors asking, can I take whey protein? I don't want to talk about other supplements, but just whey protein. Like you said, in India, protein consumption is not that great. We can't be proud of that fact. But what are your honest, honest opinion? I know Sid uses whey protein, but what's your? So I'm sure you are okay with protein supplements as long as it's good quality. But what do you think? What would you say to a parent, who's kid is asking them, like, I need to buy a whey protein, please give me some money, or
The
uh,
most important thing to know about whey proteins is there's a lot of spurious stuff on the market these days. Lot of spurious stuff. The premium brands which are available in the market, there's most of them, many of them are duplicated, and things are added to them to increase their nitrogen content, and a lot of other things are also added. I don't want to talk about them. So please be very sure, very sure about the quality of protein which you are consuming. Number one. Number two, again, don't go overboard that you start eating, one dabba of whey protein every day. Maybe you can eat a scoop full every day. That's fine. You can divide it into 2 or 3 parts. If your digestion doesn't allow you to take one scoop at one time, whey itself is not bad. Provide. See, if you will abuse anything, if you will abuse salt, it will harm you. If you will abuse whey, it will harm you. If you will use it judiciously, whey is a natural protein. It's a part of milk. So if you would use it judiciously, it's fine.
right. So yeah, as a doctor's recommendation, I can say is, use whey, but use it in moderation. How much is required to fulfill your protein intake,
Exactly.
and make sure
Yeah.
you don't get scammed in the market.
Spurious. Don't
Yeah,
get
yeah.
scammed in the market.
Yeah, so yeah, that's something that I needed to hear. Even my parents, even today, right? They're okay with me eating pizza, but they are not okay with me taking
Skeptical about.
yeah, skeptical. And I understand. Now I know why, because studies are coming out these days saying, proteins
We
are.
have had patients in our hospital who have been admitted with kidney failures, where they have abused the supplements so much that there was a person in our hospital who used to be taking about 400 grams to 500 grams of whey every day.
Oh my God.
And I don't know about the quality of the thing which he was doing, and he ended up with acute kidney failure. He had to be put on dialysis for about a month. Of course, then thankfully he recovered. He was a young man, strong boy. But then again, please don't do such things.
Right. And considering you said 400 to 500 grams of protein, he probably had to use a cheaper one, because, that's a
Definitely.
lot of money
Yeah,
for whey
that's a lot of
protein.
money.
Yeah. So,
Yeah.
yeah, so that's what, thank you so much. I know that you took time out of your busy schedule, but this should have been done last year, but we never got to do it. But I appreciate so much, sir. I appreciate you so much for taking your time. And also, I'll leave some information about you in the description as well. If where do you practice, sir? In New Delhi or in
I'm in Noida, which is
Noida?
Delhi
Right.
NCR. Yeah,
Okay.
that's right.
So, you know whom to go to from now on. If you are, especially if you are into fitness, and he knows a lot. And Siddharth Sharma, he came to meet me like long time back, and I think few months back, and it was a good time. And he keeps telling me I should listen to my dad, and I always tell him, you should listen to your dad. In terms of training, don't do anything fancy. Just lift, do the basics right, and you'll have your physique. But yeah, anyway, thank you so much, sir, and
Yeah.
for taking time from your day. And more details about Dr. Salil Sharma is in the description box. And I hope you got to learn something new. I did learn a lot of new things, and it will help me help other people better, especially people who are suffering from hypothyroidism, looking to lose weight. So thank you so much for watching. Do drop a subscribe. Are you on social media, sir? No, I don't think so.
Well, no.
Okay,
I'm
okay,
not active. I have an account on Instagram. I've forgotten the password. I never access it. I have a Facebook account which I never access.
okay,
Uh, I'm
okay.
mostly a ghost.
Okay. So you can find him in his practice, in his clinic, I think.
You
So,
can
yeah.
contact me on my phone number on WhatsApp.
Okay. Perfect. Perfect. So thank you so much. I'll see you guys again. Peace. Okay.